Hi, good afternoon, and thank you for tuning in to Canceling COVID. I'm Tonya Rivens, and yes, I'm in an unfamiliar place this time. Kind of got caught handling some other business that happens from time to time, but I appreciate you joining us and always supporting Canceling COVID. Hopefully, we won't have too many distractions. I am pulled over, I am safe. But thank goodness for technology since I didn't have anyone that could sit in for us. Of course, I want to say thank you to our sponsors, Mecklenburg County Public Health, mecnc.gov, that's mecnc.gov, as well as our sponsors, Groundwater Solutions. And of course, Groundwater Solutions, Dr. Tracia Black would be with us in just a moment. We are having to make these adjustments. So hopefully you can see me okay. My producer is giving me some cues here. And so I'm trying to position. Boy, we haven't had to do this. Just think since January, we've been able to manage and to do everything. But hopefully, I'm in position now. This isn't anything rehearsed. We're having to do this on the fly. So I believe my mouth was cut out before. MECCountyNC.gov. That's MECCountyNC.gov. And of course, Groundwater Solutions are the sponsors. It's canceling COVID, folks. You've heard me talk about it over and over and over how we are going to be relentless in dealing with this issue because COVID has been relentless, this pandemic, in dealing with us. So our goal, again, is to keep you informed, educated, and to bring real talk and real solutions. As we prepare for our first guest, and I'm referring to none other than some that have been working in the community and have been working really hard to keep you educated and to keep you informed and out and about is StarMed Healthcare. So I have a representative from StarMed joining us, and it's Mr. Chris Dobbins. Hopefully, I pronounced that correctly, Mr. Dobbins.
You did, Tonya. Thank you.
Well, thank you so much for taking the time to join with us. You guys have been really busy, that's for sure. A lot of things happening. So, kind of give us an update, starting with all of the work that you're doing as far as StarMed and opening up centers around the state.
Yeah, we've, to use your phrase, been very busy. Very, very fortunate to be, selected by the state as one of their state vendors to provide not only testing but also vaccine to our community. So we've certainly been busy for a little over a year now in providing these services. Just this past 10 days, we've actually administered over 10,000 pediatric vaccines across the state. So no small task, no shortage of challenges, if you will. But again, pointing back to where you started the show, we're all really trying to fight this COVID and really hopefully put an end to it and get all of us back to normal as soon as possible.
Well, that's good to hear. You guys also open up some facilities. You're working with Charlotte Mecklenburg schools. You're doing, of course, the vaccine concerning our children. Kind of tell us how that's been going. Are you getting a great response?
Yeah, one of the great things about where we are has been the partnership, not only with Mecklenburg Health Department, but also with CMS. We've really worked together almost seamlessly in putting together what we believe are very valuable resource sites in the community. We've identified 5 current sites where that we are now not only testing but also providing vaccine for the CMS community. And again, those strong partnerships have really gone a long way. And I think it sends a very clear message that we're all in this together. We're all working together. And we certainly couldn't do it without each other. So we're really excited about that. We do have, and I think I mentioned that we have 5 schools that we're currently working with. We selected those strategically. We wanted to make sure that they were in locations where it was a very high risk for COVID, but also a very low instance of vaccinations. So again, very strategic in setting this up. And again, that's through the great studies and data that MEC has put together, the health department has put together, and then the willingness of CMS schools, staff and faculty to help us, position those sites at appropriate locations. So we've been very excited and had some really good response so far. Parents and family members are very pleased, very happy, and we got a really strong first 7 to 10 day response, and really excited about those efforts. Tonya, I may have lost you. Not picking up your volume. Tonya, I'm sorry. I think we're having some audio difficulties. I'm not picking up your volume.
So I understand there's a little bit of issue with my audio. I'm checking to see if you can hear me now.
No.
Okay. I was checking and asking, what have you all? I'm sure you kind of had to get creative to get some parents and children in. I know one of the ideas was gaming systems was one that was introduced as a giveaway. But what are some of the other, I guess, plans or what you had to do to kind of engage to get more or just to get the attention of the children and parents?
Yeah, I think what we found is in communities and areas where initial vaccination was taken up, there seems to be a pretty strong correlation that the children also are being vaccinated. Our struggle, and certainly, one of the emphasis areas that we spend a lot of time on is, how to get to communities that may have transportation barriers, may not necessarily, they're on the fence, if you will, about getting vaccinated. So that's where we've spent a lot of our time and a lot of our energy and a lot of our support is going into communities with those type of hesitancies, if you will, and trying to, find things that may encourage folks to, if not get a vaccine, at least have the discussion about the potential of getting the vaccine. So sometimes it's a conversation. It's not a, you changed my mind overnight. It's about establishing trust and making sure that we can answer any questions that our citizens have or our clients may have, so that they feel comfortable. And sometimes that takes time. So we certainly understand that, but we also understand that there's some soft skills associated with pediatric vaccines, and sometimes you need an environment that is conducive to the youth, and that sometimes there's could be gifts or there ice cream, or it was kind of funny. We had a grand opening, if you will, a couple of weeks ago at our Tuckasegee site, and one of the gifts that we were giving to kids was a yo-yo. For those of us of silver hair, a yo-yo is a pretty common thing. But you would be surprised at the number of kids that didn't really fully understand how a yo-yo operates. So it was interesting to see some of the parents interact with children, helping them through the yo-yo experience, if you will. Ice cream, balloons, again, things that try to help put the children at ease so that you can reduce some of that anxiety, make it a little bit more friendly, if you will. And then certainly, video gaming and Xbox and some other drawings, to incentivize and encourage children and their families to come out is also part of our effort as well.
So, Mr. Dobbins, again, with StarMed Healthcare, doing great things all about and around the state, educating our community. Let's talk about the boosters. People are still confused. I was in the presence of some family, and there was an 18-year-old. Well, he was actually 23, and he said, I don't have to get the booster right now. And so people still don't understand who needs to get the booster, who's eligible, why we should get it. Can you kind of just speak on that a little bit?
Yeah, I think it's certainly a conversation starter. And to be clear, there's the booster, and then there's also what we would classify or consider the additional dose. A booster is pretty much given whenever a vaccine series has decreased over time, and through no fault of the individual. It just it wanes after several months. So a booster would be in order. An additional dose is a little different, because then we're talking about individuals that may have a severely compromised immune system. So just to differentiate those two. The other thing is boosters have not been approved for everyone at this time. So there is still some discussion there. So making sure that you do ask these questions and make sure you understand, which category you fall in or may not fall in is really important. The other thing that people, want to ask questions about the booster is, are there side effects? What am I going to experience? And certainly there's, everybody's a little bit different, so these things may vary, but very similar to that of a flu vaccine. Sometimes individuals have a soreness in their arm, or swelling, or they may run a fever, a light fever, or maybe experience some body ache. So nothing that we've seen to indicate anything different with the booster shot. But again, I'll kind of go back to where I started. When in doubt, ask your primary care physician, ask us, ask someone you trust, and we certainly can help you understand what's the best decision for you about getting a booster shot. I personally have already had my booster shot. It's because I fall into a career field that has high exposure capabilities or potential, and I did not hesitate as soon as I was eligible. So. And then, of course, the question then becomes, which vaccine do I get? If I got Pfizer the first time, should I get Pfizer again? Moderna, if I got J&J, which one? So again, some of this is just individual choice and preference, because there is no clear, definitive direction of, if you got this, then you should get that. But we certainly do encourage individuals to, when and where possible, have their basically their antibodies checked to see if they have a high resistance. Low antibodies means that your body has got a reduced ability to fight off the virus. So that might be a time for you to consider getting the booster shot.
Well, one of the things that we know that you all are constantly doing is educating and providing the services in the community. As we wrap things up, I'm just checking and to see if there's anything else you would like to share. Again, I do apologize. Totally miscalculation here on timing, that I got tied up. And of course, technology does allow us to go ahead and let the show go on. And sometimes that could be, I guess, a blessing and or a curse, because I feel bad. You're all there and set up, and I'm here not set up. And so I appreciate you going on with the show. But is there anything else that you would like to leave with us as we wrap things up?
Well, just to say thank you. I think that's the message that StarMed has for the community is thank you. Thank you for trusting us. Thank you for trusting the Mecklenburg Health Department. Thank you for trusting CMS Schools. Again, this is a community response. It's a community effort. Nobody can do this by themselves. So I guess if there's any parting words that I would have, it's thank you, and continue to work together and work with us so that we can put a stop to this virus, and really hopefully get back to normal and be able to enjoy our families during the holidays and beyond.
Thank you again, Mr. Dobbins of StarMed Healthcare, all about in our community. We'll have the website up as well as the phone number. Our producer is very good about that. I just want to say again, sincerely, thank you for taking the time to talk with us, and especially again, under these circumstances. Thank you, and enjoy the rest of your day.
Thank you, Tonya, and thank you for all you're doing.
Absolutely. As we continue to come to you, I am safely sitting, wanting to make sure that we continue to bring you Canceling COVID. We're doing some transitioning with the show, but this is not a part of the plan. It was not a part of the plan. I've been out since 9 a.m. and just got delayed, but we are going to continue, of course, metcountync.gov, our sponsor, and Groundwater Solutions, which we have an opportunity every Wednesday to talk with Dr. Tracia Black. And Dr. Black is joining us as well to kind of give us an update on what's happening in the community. She's all out and about. And Dr. Black, you know about making these transitions where we are constantly on the go. And no matter how much you plan and work to make sure everything is on point, it just doesn't always work out that way.
Exactly. I was last night I had to do a panel discussion and I was in my car in traffic. I just didn't make it to the computer. So the good thing is that we roll with the punches and we keep it moving.
Well, the sad or the funny part is we managed to go since January. I've never got caught. Now I've got caught running behind, but never caught in the vehicle. Right. And that's what's happened this time. But, kind of tell us what you're getting out there, out in the trenches. What is the pulse on right now, especially heading into the holidays? Are you seeing the numbers pick up of people that are trying to get, I know you said last week a lot more testing, but what about vaccines? How is that coming along?
Well, I think that's still steady. We're not seeing folks who are showing up wanting a new doses or initial vaccines. Those numbers are still not high. What we are seeing is lots of folks showing up wanting boosters. And so daily, we're our booster delivery is very high. I think one of the questions that was asked was who's eligible. I think StarMed has really told us he gave us correct information on that. I think we do give boosters to anyone who shows up if we have extras, because we'd rather not waste the dosages. Pfizer vaccine vial, 6 boosters. The Moderna will give 15 boosters, for example. So if we open a vial during that day and someone shows up and they're not 65 and older, we're going to give you a booster if you request that.
So I was out, not out, but I was a part of a meeting last night, and there was a presentation, and it was around, of course, our community. We've seen improvement, but in North Carolina, still seem to be behind as far as African Americans. And the conversation
Mhm.
revolved around why, and there would seem to be, excuse me, one comment is because of the lack of health care that our community maybe are hesitant. And I pointed out, even though the testing or the vaccine, all that is free, if you have no insurance, medical insurance, and if there are side effects from the vaccine, and of course there are a lot of factors, but if
Mhm.
this is just one of them, me personally, if I don't have health care insurance, I'm not going to even entertain the thought of being bothered with something that's going to create another debt for me that
Mhm.
obviously I don't need to be bothered with. Um, are you seeing that from, or do you think that is the notion from a lot of people?
I think that's a very valid reason that folks are not taking the vaccine. We talk a lot about trust of the medical profession and the things that are being delivered to us and communicated. And I think what I hear a lot is, again, if there's no care, that I don't have basic health insurance, why is there such a push for me to take this vaccine? You don't care that my diabetes is unmanaged. You don't care that I have chronic heart disease. I can't get my medication for that, but you want me to take this vaccine. So I think that the whole issue of healthcare is why African Americans are not running to get the vaccine. But I had an interesting conversation with a doctor, one who I hope is going to end up being our medical director here. And she said, there's a lot of distrust, yes. But at the same time, she said that she encouraged her and her family to get the vaccine because if you contract COVID and you end up in the hospital, if you distrust the healthcare system now and you end up in the hospital fighting COVID, then you have to trust those doctors when you get there.
Yeah.
So don't go to the hospital. The best way not to go to the hospital is to take the vaccine. And folks who were listening and who I've shared that with, they're like, so maybe that distrust ought to prompt more people to take the vaccine as opposed to not take the vaccine. And I hope that makes sense. It's kind of a circular argument, but that is a real reason. The distrust, the what if something happens, how am I going to get help? I'm going to get another bill. Those are many. And then there are many other layers. You're not fixing my housing problem and I'm on the street. Why should I take this vaccine?
So another issue that was mentioned too, which I was, when it's relative, and I think that wasn't highlighted. And I say this to you because obviously we work in the community, and someone else who says she's in the community commented that she knew some people who said they had a relative who passed away as a result of the vaccine, whereas we also know underlying health conditions play a huge role, or someone who had a side effect that caused maybe their fingers to go numb or something along those lines. Are you hearing that in a large amount? Are you hearing those type of stories?
I'm not hearing them in large amounts, but I'm hearing them consistently. And vaccine injury is real. For any vaccine, there are vaccine injuries. And I've shared the vaccine registry, the registry of adverse vaccine events. Folks can look at that. You can go and see what people are reporting with regard to the COVID-19 vaccine. But I definitely hear horror stories of people who are dying from the virus, 90% more than I hear the stories about the adverse events.
Personally, I feel like we're well beyond that. It's more about having one-on-one conversations. We
Mhm,
push
mhm,
that. Everyone who's supported, it's a
mhm.
personal choice. We respect that. But I would just like your take right now on where you think we are as a community. We see the spike happening in Europe again. In the back of my mind, I'm sitting here saying, okay, Are we reloading? What's happening here? We are, of course, all the experts kind of fearful. The cold months, the holidays heading back inside. There's the mask mandate where we've got some good numbers here in Mecklenburg County. But just your overall take on where we are with this right now.
Well, I think that we're in a good place. I think we're in a better place than we were 18 months ago. I think we know more about the virus now. I think we have a large number of people vaccinated. We may not have met that benchmark that we were hoping to get to in our community, but we're much better off. I think folks are taking precautions more, though even those who are unvaccinated are taking precautions to keep themselves safe, to improve their health. They're getting tested regularly. I think the federal mandates that have required that testing, if you're unvaccinated and you're in a government position or you have more than 100 employees in your organization. So you're seeing testing numbers go up. But I think the numbers of positives is staying consistent. So to me, that means because earlier, say last year, and we were looking at the numbers and the numbers were low, but testing was also low. So testing is now up and the numbers are still pretty consistent. So I think that means we're managing this virus better. When I make the calls to folks who are positive, they are managing the infection better. They're not getting as sick. They're utilizing the monoclonal antibody treatments, and they're living through this. So I think overall the numbers we may have spikes, but I don't think that's going to result in the deaths where we've seen that before. I think we're still going to have that, much like flu vaccinations, and during the flu seasons there are deaths, but I'm believing that we're not going to see those very high numbers.
Well, Dr. Black, you've been out there from day one, and just, salute again. Congratulations. I know StarMed is working too. When we last talked, you guys, they are on one side of freedom. You all have opened up on the other side. You're over at, I believe, Ashley and
Allegheny.
Okay, and what other locations? You're still in Union County. Of course,
We're
you're on
still in
Reagan
Union
Drive.
County. We're still on Reagan Drive. And today we are at adult daycare. We are also headed up to Winston-Salem this evening. And then we'll be we'll be out on the East Coast in Wrightsville all weekend, Thursday, Friday, Saturday.
Well, I want to apologize to you as well. You're in the office. You're all prepared, and I am in my car, not dressed for the occasion. You guys, if you go and see all the shows that we've done, they've all been very professionally done, but we are committed to this conversation. Of course, we're back on Friday with another conversation. But Dr. Black, I want, before I wrap things up, allow you the opportunity, if there's anything else you would like to share in closing, including your website and phone number and additional information.
Okay, so just remember, guys, one of the things that we're doing now is the travel pass. So if you are needing a PCR test results, which is usually what's required for travel or events, then we are offering same day testing. You may get your PCR results within 12 to 14 hours, or if you need them while you wait, maybe your plane is taken off in 2 hours, we have that service available to you as well. And those services, there are fees associated with that. We have cut our costs half of what most people charge, but free testing is still available if you have 48 to 72 hours to wait on your results. But that is available now. We just want you guys to stay safe. As far as Thanksgiving, I think that was one of the things that we wanted to talk about today. I do recommend that everybody get tested during next week. Between Tuesday and Wednesday are the best days to get tested. If you can find a site that's open on Thursday, then you should the closer to the holiday or to your event is when you want to test. If you have several people who want testing in your family, like we do that as well, and can send a staff member or a team to your location if there are multiple people who need to be tested. But I do recommend, if you're going to congregate, you want to have that wonderful, joyful Thanksgiving dinner feast, please, everybody in your home get tested. That's kind of how our culture has to be for the next little while.
Next time I should let you just host this show until I arrive is what I could have done. But
I will do it for you.
I've just been advised, pre-planning. We're getting there. But I understand there's a question about boosters on the on what somebody watching has a question about boosters. Can you speak on that?
If you're taking the vaccine and you're depending on that vaccine as your safety strategy for COVID-19, then I highly recommend boosters. Because the vaccine, the effectiveness in your protection is going to wane. Just like the flu vaccines that are taken every year, if you're trusting that vaccine, then you need to stay with the booster program. It may be every 6 months. We don't quite know that yet, but we do know that if it's been more than 6 months since you were vaccinated, the booster is recommended.
Well, thank you. We appreciate you again. Thank you for always stepping in and helping out. And I so appreciate you. I appreciate your sponsorship. And again, enjoy your weekend. Have a great holiday. We're going to, of course, not be back next Wednesday because of the holiday. And Dr. Black will follow up with you as well. But Groundwater Solutions and the Genesis Project, we so appreciate all that you're doing. Thank you so much, Dr. Tracia Black.
You're welcome. Thank you, Tonya. Happy Thanksgiving, everyone.
Happy Thanksgiving to you as well. Well, folks, even with what we're dealing with here, I've got a great producer that's kept me on point, and our guests here, again, I apologize to you. This is not the product that we usually bring, but certainly we bring you knowledge and information. We worked really hard to cancel COVID, and at this point, we are seeing some of the work that you put in. We're making progress, and certainly that's a good thing. As far as announcements, of course, we're back here on Friday, as I just mentioned, with Dr. Tracia Black. On next week, we will have a pre-recorded show. So certainly we will not be live because it's Thanksgiving next week, folks. So enjoy your family and your time, and we'll enjoy our time off. We're doing some transitioning. We'll make that announcement. You know, this has been going on since January, and it's been quite a run. And again, we cannot say thank you enough for you all. As far as me, some things are happening. An announcement today. I'm returning to Praise 100.9 FM. Yep, I'm going back home. I call it homecoming season. I was there 2005 to 2008. Praise 100.9 FM. You can catch me on Saturdays from 10 to 2, starting this Saturday. So hopefully you'll tune in. And I always say, I ask you guys, you know, for your help, support. I also ask and solicit, how can I help you? If there's something I can help get the word out or show you or provide some information or connect you with people, I'm always willing to do that as well. As we always do here, as always, life's challenges make you better, not bitter. A little challenge today. Hopefully we're able to work through it to where you still got the information that you needed. Thank you again to our sponsors, Mecklenburg County Public Health, mecnc.gov. That's mecnc.gov. And thank you to Dr. Tracia Black, Groundwater Solutions. And thank you to Chris Dobbins of StarMed Healthcare. Have a great day, everyone. We'll be back on Friday. We'll be out of the studio. I can promise you that. It's a great day here in the city. Make sure you get out. Be careful. Be safe. Remember, we're still in a pandemic, so take precautions. And most importantly, be well. I'm Tonya Rivens. Thanks for tuning in.